The World Health Organization warns the heavily mutated Omicron variant poses a very high risk of leading to a surge in global infections. The WHO chief sounded the alarm on Monday, saying an international agreement on pandemic control is needed.
The emergence of the highly mutated Omicron variant underlines just how perilous and precarious our situation is. South Africa and Botswana should be thanked for detecting, sequencing, and reporting this variant, not penalized. Indeed, Omicron demonstrates just why the world needs a new accord on pandemics. Our current system disincentivizes countries from alerting others to threats that will inevitably land on their shores.
The WHO says no one has died of Omicron yet, but more research is needed to determine how effective vaccines are against it. This variant was first identified last week in South Africa, where cases have risen sharply. It has since been reported in more than a dozen countries, many of which have banned visitors from some southern African nations. Sweden on Monday confirmed its first Omicron case after a traveler returned from South Africa last week. And travel plans for hundreds of thousands of people are now on hold after Australia paused the reopening of its borders. It comes as concerns grow about this variant, as Greg Navarro reports from Sydney.
The next phase of Australia reopening its international borders was set to go into effect December 1st. That would have allowed groups including international students, skilled migrants, and tourists from at least 2 travel bubbles into the country, provided they were fully vaccinated. However, there are rising concerns about the Omicron virus here in this country. In fact, Australia has now at least 5 confirmed cases. We're told they all originated from southern African nations. They're all fairly young, and at the moment they're exhibiting very little or no symptoms at all. But it is enough to prompt the government to put a pause on that reopening by at least 2 weeks. That'll impact an estimated 200,000 people, as well as businesses and institutions. We're very much looking forward to having them back in this country again. That decision will essentially give the federal government and health officials time to learn more about this variant. We are told so far that they believe it is more transmissible than Delta. However, they believe it may be less symptomatic than what people experience when they contract the Delta variant at this point. Also, the federal government has currently stopped flights from 9 African nations from arriving into the country. Those people who have arrived from those destinations and are here already must spend 2 weeks in quarantine. The government's also imposed a 72-hour isolation mandate for anybody arriving from anywhere in the world, regardless of their vaccination status. One thing that health officials and the federal government here say is working in their favor is the current vaccination rate for the entire country, which is sitting around 86%. However, one thing that health officials around the world are currently investigating is to find out just how well vaccines that are currently available to people do against this variant. Greg Navarro, CGTN, Sydney.